I don't usually actually keep notes with me, but what I'm doing today, I am actually reading from some of my reports and things. So I do actually need my notes, which is a bit odd for me because I don't usually talk with these, but bear with me with that. So I guess just, why am I doing this? I've got this little pendant that I keep in my, I've got this little thing that I keep in my bag with some special things in it. And this is a little pendant that a fellow inpatient gave me. I can't remember when. But I do remember that I was sitting in the corridor of the inpatient unit. I was very quiet when I wasn't causing mayhem. In between, I was very quiet. And I just have this, see some smiling there. I was sitting in the corridor in my dressing gown, and I very often was bandaged up. And this patient who I knew very well, you get to know the ones, us repeat offenders, revolving door. And he just bent down to me. I was very distressed, and he gave me this pendant, which was his mother's. And he's still in the system, in and out, and his kids are still not with him. So I keep this to remind me when I'm maybe afraid doing this kind of stuff, or think, is it enough or is it right? That's actually what this is about. And this for me is about meaning making. It's not about blame. Because in the most, and I need to say this, in the most, staff were really kind and good to me, and they cared. This is not about blame, but it is about speaking the truth of what happened, because I've spent a lifetime not actually knowing who I was or understanding myself with many mental illnesses. So this needs spoken for myself, and there's a sense of responsibility around that. So I'm just breaking this into 3 parts: drowning in disorders, cold concrete cell, and holding hope lightly. So this man, Don Tate, you can look him up. I was in a treatment center in 2017, and this man, I think, saved my life. And I just want to read here. I was asked to write a piece for his memorial. He died in 2019, but he'd become a great friend and mentor, and he used to run a group in the treatment center every morning, just a group talking about shame, forgiveness, those kind of things, and he was fierce. And I want to read what I wrote about him. So sorry I can't be there with everyone to honor and celebrate Don's life. In treatment, I was a little scared of his fierceness, but his message, delivered in love, saved my life. He became a close friend and mentor over the last few years, and I miss him terribly. What he taught me permeates every aspect of my life. When I doubted myself or fear crept in, he always said, "Just speak your truth." Mr. Tate, I will continue the work you unlocked in me. I will share my experience with the courage and compassion that comes from gratitude and acceptance. I will honor the gift you gave me of a new pair of glasses through which to see the world. Thank you, brave warrior, for helping me find freedom. Rest in peace, knowing the multitude of seeds you planted will breathe life to many. He was a man who had no judgments. He'd done some dreadful things in his life. And he used to put the vodka, and he wouldn't mind me telling you this, in his windscreen wiper thing to drink. He used to defend the biker gangs and things in Canada. He was a notorious lawyer. But he helped me find life again. And I'm just going to start by reading this poem I wrote, and it's called Blinded. What did you see when you looked at me? Bandaged, broken, breaking down, symptom smothering, suffocating sound. Risk assessed year on year, those boxes ticked. The plans you made the same each time, which I then went and disobeyed. Repeat offender, that was me. Revolving door we all could see, or not. Textbooks teach many truths, they have their place. But I am me and you are you. Did you not see? 100 stories carved upon my skin. Speak a truth I needed heard. But I'd been labeled to be understood, and a heavy cost was incurred. Not all is as it seems, you know, for you nor me. Behind the walls and masks we wear, we're all just human. We all know despair. So before you judge or label me, please make some space and truly see. Drowning in disorders. This is me. Schizoaffective disorder, schizotypal personality disorder, bipolar disorder, major depression with psychotic features, anxiety disorder, borderline personality disorder. That was 2011. I was 37 by the time I got that. Anorexia, bulimia. And in 2020, although I no longer believe I'm disordered, I finally got the diagnosis of complex post-traumatic stress and dissociative disorder. What is so wrong with you? 1993 in an old asylum. 2011, recurring microsurgery for lacerating my vein. 2017, 2 antipsychotics, 4 tranquilizers, sleeping tablets, and an antidepressant. 2011, my kids visiting me in the inpatient unit. I've asked permission to share their photographs and their story as well. We've spoken about this. And my husband's here this morning. And what he went through as well, apart from the wider family, just the fear and the... And this is a awful photo. I was on a day pass. You can see I've got my hospital band on. That was my daughter and I at the Loch Ness Discovery Centre. And this was when I was in ICU, and it's a note my mom wrote when I was on life support, and she was in South Africa. Gary and I were separated at that time.
And now we lots of pictures today, and I got to read books tonight, and I want to sing the song for you. I love you, I love you, I la 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 love you. You're my best friend, you're my best friend, you're my best mommy ever. Okay, okay, you're my best mommy ever, yeah.
Matthew George. Gary sent me that voice note when I was in hospital. Many years of 8 years, I missed out on my kids. I wasn't there. So what is electroconvulsive therapy? It involves passing an electric current through the brain large enough to induce a seizure. There is no generally accepted theory for how it works. We don't actually know how it works, and approximately 70% of people who get ECT are women, because they say women are more depressed. It's International Women's Day tomorrow, and I launched my business 3 years ago on International Women's Day. Yeah, so it's a very significant time, actually, tomorrow. And today really is about that medicalization of violence against women and the silencing of that. So why is it used? Well, Mind states on its website, repeated ECT is only recommended if you've previously responded well to it or if all other options have been considered. The Royal College of Psychiatrists states ECT is a treatment for some types of severe mental illness that have not responded to other treatments. It is usually considered when other treatment options such as psychotherapy or medication have not been successful or when someone is very unwell and needs urgent treatment. It is of concern to me that the people who can do this on their site have a disclaimer which says we make no representations, warranties or guarantees, whether express or implied, that the content in this leaflet is accurate, complete or up to date. I don't think that that's okay. And I'm not sure if that would happen with a cancer drug or other kinds of treatments. So this is the bits that I'm just going to read through. These are from my direct notes, okay? So this is not this is what people have written about me. Just to give you some idea of the me standing here, of the me along the way, those many diagnoses. So 1988, the psychiatrist report, 14 years old, she definitely has significant cognitive and somatic features of a major depression. She is also experiencing feelings of worthlessness and feelings that life is meaningless and empty. She has felt life not to be worth living and has even had suicidal ideas. Lisa has significant anhedonia, which means I couldn't take pleasure from anything. 14. 2012, the psychiatrist reports she had thoughts of self-harm and did not feel hospital would be beneficial again. I was first admitted in, I think, July or August of 2009. I'd relapsed with my eating disorder. 2012, husband feels she is high risk to self. He would prefer that she was incarcerated rather than kill herself. Inpatient notes, Gary reports Lisa tried to jump out of car on way to hospital. Well known to psychiatric services with multiple admissions. Tries to abscond. Lisa reports she is full of badness in her whole body and needs to get it out of her. Reassured. Talked about her kids and how guilty she feels. Is anxious about them going away as they've never been away without her. 2013 notes from various psychiatrists. Attending self-harm group has found this quite stressful and of limited benefit. No evidence of depressive symptoms. She has been having flashbacks of her past. She hears a baby crying and believes a man is following her. She does seem to have some psychotic features on the background of depression and EUPD. She reports she is hearing voices which appear to be pseudo-hallucinations. Brief psychotic episodes. Feels that things are happening in her house. Somebody sent a spirit to a man. He kept her in check. No one else has seen him. Severe EUPD, psychosis, pseudo-hallucinations, deterioration in mood, had 3 courses of ECT to date. This lady has a long history of deliberate self-harm and overdoses. Spectacularly cut her right arm, which required microsurgery. Douched herself with petrol and threatened to set fire to her clothes. EUPD, chronic depression, eating disorder, treatment to date, psychiatrist, CPN, social services with family, eating disorder team. Letter to the occupational health doctor I hadn't worked from 2011. Increased impulsivity and self-harm. Lack of ability to control self-destructive behavior. Increased alcohol consumptions. Lack of any period of stability in the past year. From a point of view of her specific employment as a support worker in the early years service, I am obliged to point out that there have been significant child protection concerns during this long period of instability, and child and family social services are involved with Mrs. Morrison's own children at present. As Gary said, there weren't child protection issues because he was with the children, but social services were involved. Unfortunately, Mrs. Morrison has not been able to make use of her treatments in a way which has significantly modified her self-harming behavior, and I believe that she remains a risk of impulsive and significant deliberate self-harm. Given the long periods of instability and active self-harm, I believe that her prognosis for recovery is limited. 2009, I went into the service. I was in after I had my daughter as well. I'd been unable to make use of treatments in a way that had significantly modified what treatment. 2014 notes. I've got my notes just up to then, some of them, because of my dreadful memory loss, I did ask for them. August 2014, EU PD and question mark around PTSD. It's in my notes that I had suffered significant abuse in my life. In many ways, on different occasions, at different ages. September 2014. Oh, and it says not clinically depressed. 2012, it was not depressed, and then it was depressed. It's not depressed. September 2014, admitted to 1S Craigavon Area Hospital after discharge from ICU. Felt awful following the meeting with social workers, where I was told she couldn't see her children for 2 days following deliberate self-harm. Made me feel guilty, like I was a bad mother. And it's an interesting thing just to comment on that, because the thing is, actually, when we think about listening to people, the safest time for me to be with my children was 2 days post self-harm, because what happened, and the pattern was that once it healed and the stitches were out, then I would need to harm again. So in fact, if we looked at the pattern, that's the safest time for me to be around. I didn't harm in front of the children. Talked about insects crawling all over her skin, seeing blood on the walls, asked about medications and ECT. Lisa admits to being relieved that she is commencing ECT as it has been beneficial in the past. And I need to say this, nobody forced me to have ECT. You know, I did ask for it. This was the 4th time, and I asked for it because getting an anesthetic was like dying. It was that time when you just went under and you were totally removed from your life, which you just didn't want to be living. There are, though, I can only share my experience and my truth and my story. I don't speak for all people. And I know that there would be people who would say that it's helped them. And I know that on the first few occasions, Gary would say that for a very brief period, there did seem to be a slight lift in my mood. So I want to be clear about that. I see in my notes, I was told and I gave consent. I didn't know my rights around, that issue of trying other things first, therapy. I was always deemed too unwell for therapy. And as we know, as John and I have done this research piece and audit on patient information leaflets, and what I know now, I don't believe we could have given informed consent. Gary and I didn't. We thought I'd had 2 or 3 sessions. We couldn't actually believe it was 6 over 7 years. As well as when you're in that state, Gary was just worried I was going to die. You'll do anything. You'll do anything. You'll try anything because you're so desperate. Gary is a well-equipped businessman who is not afraid to speak up about things, but he was And he was afraid that he would be deemed not okay, and then our kids would have nobody. You know, so we really need to be thinking about the whole family and these things and how we're communicating with people. These notes also illustrate that the person you see here, you know, not all is as it seems, you know, and the things sometimes that we're dealing with. October 2014, EUPD, recurrent depressive disorder. Can't seem to agree on my depression. And I don't mean that. Nobody was unkind to me, really. But November 2014, Lisa states she is going to try lithium, as it is her last hope. Lithium was suggested. Oh, that was just a picture I drew. 2014 to 2017, I don't have my notes, but August 2016, I have a letter that I was referred to clinical psychology. I don't remember what happened about that. April 2017, I went to the treatment center in South Africa. And between 2009 and 2016, 72 EC treatments. So if you're thinking about the guidelines for who gets it, and if it's been of benefit before, you know. There was talk of supported living, Gary tells me. Gary is my external memory drive. I'm very lucky we got back together, otherwise there would be larger portions of my life I didn't remember. And this is a quote from him. One of the reasons I took thousands of photographs when the kids were young was because I wanted them to remember Lisa, since I knew she wouldn't be alive when they were older. Reflecting on then and now. And I've got this building, I was delivering training, ASW training, in that building over there. And I remember it was October last year, and I'd actually been an inpatient for 4 weeks prior to that, which still happens, and staff are so good working with me and with my safety plan that, you know, I say in it, this is not a relapse, this is part of the journey, and I'm not ill, this is just, you know, and they've been fabulous. They really have, and the home treatment team have just learnt about the dissociation and the voices and have respected and honoured that. And it is really possible, and I'm so grateful for that, because I've still needed that support as I heal from a lifetime of these things untreated. And I remember walking from the train. I also couldn't take a train until about 6 months ago, because when you've got that trauma held in your body, it's that if I had my car, at least if I needed to escape, I could do that. Whereas if I needed to rely on a train, I couldn't. And I can take a train now. And my daughter, bless her heart, who took me one time before I went to treatment, and I was so drugged and so anxious going to Belfast with her. It was just a nightmare. You know, and she sent me a message, say, so proud of you, Mum, you know, the first time I went on the train. But I was walking along that avenue, and it was a beautiful sunny day, October time. And I was walking and just looking at it and thinking, like, I almost can't believe that I'm walking along here in this beautiful place and the sun shines out, and I'm going to this beautiful building to deliver training to social workers, you know, who want to become approved social workers. They responsible for the detention process. And there was just this visual image for me of this and these two things. I could see them so clearly. I was about 19, I think. I can't remember an awful lot, so exact ages. So don't quote me on any of this and then tell me that you don't believe me. Oh dear, how we respond to people following disclosures of trauma. The damage that is done when we don't believe lasts. So that cold concrete cell is quite literal cold concrete cell. I was in an old asylum in South Africa. I first attempted to take my life at 16 and then again at 19, and was on a load of medication. I've been on medication since the age of 14. And I was sent to an old asylum. I was in the open ward and then ended up in the lockup ward because of repeated self-harming and attempts to die. And literally for the first, I can't remember how many nights, when you went into the ward, they stripped you of your bra and you had these crimpling dresses that you were put into, you know, like these A-line, I don't know what they're called, but that's what you were put in. You were locked from place to place. And because I was at risk of harm, at night time, I was put in a cold concrete cell, stripped, put in a cold concrete cell and left for the night, the door locked. So you literally there was a window up there. There was no toilet. And when you went to shower, you lined up. All of us women lined up and were stripped and had to shower along with the nursing staff around. And there were straitjackets and there were padded cells. And that was the first time I had ECT as well. So you think about, we sometimes don't know people's experiences when they're coming into a service as well, you know, and that was disclosure of various traumas. And the problem was in my brain and temporal lobe epilepsy, and they couldn't agree either with what was wrong with me. So there was a bit of an argument about my diagnoses. I think there were 4 or something like that. And these are the medications that I've been on. This Deirdre, fabulous Deirdre here, drew this for me. Gary helped come up with we kind of did a collaborative piece, didn't we? And I'm so appreciative of that because it's like a human being somebody with love in their heart has written all of this. That took me away from myself. And a lot of these medications I've been on over that period of time, 2009 to 2018. Meloril, which I was on, thyroidazine, it was taken off the market because of heart conditions. I was on that when I was in the lockup ward. But you just look at this, Abilify I was on in 2017, the depot, Risperdal, lithium, sodium valproate. I was on carbamazepine in South Africa, mood stabilizers and antipsychotics, chlorpromazine, haloperidol, diazepam, Lyrica, I was on for many years. Yeah, it's all there. Quetiapine and the antidepressants. And 96 seizures in my brain, electric currents went through. It's time for a new script for mental health. And my thought was, as I was walking down there, I'm so grateful for the life I've got today. And that's why I have that piece, because when I go back in, there's people who were in with me, who are still in. And I know that so many of them have just had, I won't use John's language, but bad things have happened, you know, not the right treatment for them. And then we go into these places, and even with our lovely brand spanking new units that we have, it doesn't matter one little bit if you still have no power and no choice and no hope for recovery, which was my experience. I've got in my notes, the team have lost hope in me and I've lost hope in myself. I lost me under all of this. There was no talk of, I had been a competitive swimmer. I had worked. I had played in an orchestra. I'd done a good job with my kids up till then. I ran baby massage classes. I was an aromatherapist. We moved halfway across the world. I came here not knowing anything, with no job or anybody, and I made it work. I had no fear of abandonment. Gary was traveling to America and I had 2 small children and was doing my degree. I couldn't possibly meet the criteria for fear of abandonment. In fact, I don't trust people. I've got my dog. I prefer my dog sometimes to anybody, even my best people here. So it's like, just because it's brand spanking new doesn't mean it's not still a cold concrete cell if you lose all sense of self and personhood, if you don't believe that there's a life beyond this, if what's happened to you is not recognized and believed, and well, it was believed in here, but nobody knew what to do with it. I was told, don't talk about that because you're making yourself ill. You need to leave it in the past. We can't leave it in the past. It's in us. It's in our bodies. The research tells us that. I don't choose to hear voices and see visions. I don't choose to remember things so painful and so horrific that happened to me. I don't choose that. And other people don't choose that. And that's not saying that I was this wonderful patient who was really easy to get on with. I was challenging enough. I absconded and set fire to things, and I used to steal the baubles off the Christmas tree, and all the impatients hated me for that at Christmas time because I thought I could cut myself with it. I wasn't very popular. And me, this middle-aged woman, dropping my 2 kids off at their local school, didn't fit the mold too well. So we need to think about trauma-informed environments. What are those? Because so much of this illness that we have happens because of powerlessness and things that happen to us. I'm not saying for everybody that's what it's like, but bad things happen and they do impact us. And yes, it changes our biology, it changes our brain, it changes our nervous system, and we need help to rewire. And all this self-regulation and personal responsibility, as much as that's important, of course it's important, all those things, but 5 steps to well-being, let me tell you, if you've been on the level of antipsychotics that some of us in this room have been, don't come telling me with a diet that I've just got to eat healthy and get out and walk, when the only person maybe that I saw for 5 years when Gary and I were separated was my chemist for my daily scripts. You know, this is why we involve people with lived experience. It's easy to involve me because I speak nicely and I've had my anger and my frustration heard, so I'm okay to listen to. But it's a bit more difficult to listen to the people who are still angry and are still... But we tell people to do things and we blame them when they don't do it. And I'm not saying there's not that ownership. I was in a cycle of learned helplessness. It wasn't helping me being an inpatient, but I didn't know how to live outside of that because every control was stripped of me. And if you think of what had happened to me, the abuses that were done to me, and then I was on one-to-one observations and I couldn't go to the toilet. I had to undress in front of people. I wasn't allowed to run because of my eating disorder. I couldn't self-harm. And you're stuck in a courtyard, which everybody thinks is fabulous because there's a lovely garden, but you feel like a caged animal. You're seeing things and you're hearing things and there's blood running down the wall and you're on your own and nobody wants to talk about that or what's happened to you. And I've heard recently about, you know, the lack of communication with people. You know, I teach about this, polyvagal theory, context, choice, connection, context, the why, the what, and the how. We need that to feel safe. Our nervous system looks for it. We need to feel connected, but we're so busy with self-responsibility. Co-regulation is a biological imperative. For the rest of our lives, we need other people. And yet we're shamed for needing help. And what's happened for me, and I'm so grateful because there's so many of you in this room who have helped me with this journey, and my therapist, is I needed somebody to do it with me, to learn how to regulate over and over and over again, because I was 47 or something when I went into therapy. I couldn't do it. I couldn't engage with I can use the sensory garden now in the inpatient unit because I've had 3 years of someone doing with me and teaching and helping me regulate my breathing after a lifetime of not knowing how to do that and actually learning to reconnect with the body, which is a painful experience as well. Dissociation is very helpful. And I'm just going to tell you one story. Sorry, coffee's going to be a little bit late. 25th of the 3rd, 2014. And this is a photograph from the Roan Sexual Assault Unit. And I've had permission from Dr. Olive Buckley, who I met with. She was the clinical lead who saw me after I was raped in 2014. And that's a photograph. That's a photograph of the corridor that they have between where you're clinically assessed and then where you meet with. And I'm just going to tell you briefly about this story. These are from my notes. Lisa arrived to the ward via a taxi alone. Rape allegations 2 days prior. CPN took Lisa to the Roan Sexual Assault Unit. PSNI aware and process of investigation began. PSNI came to visit Lisa today for questioning. Lisa states becoming upset and distressing. ASW, who was present due to vulnerability, to review in the morning with the social worker on the unit. October 2014, I was an inpatient 4 times that year. Having flashbacks, Lisa spoke of her worries re children, saying she feels she's missing out on their lives. Lisa really misses her 2 kids and worries they don't miss her. States she feels hopeless and has broken up her family. Lisa told her alleged attacker would not be prosecuted as there was not enough evidence. Lisa, very distressed, feels she does not ever get justice. She's getting flashbacks on her attack and advised to contact Nexus. Now, just to say about that, Dr. Buckley, Olive Buckley, I tell this story because it represents so much of what recovery has been for me. And this was the one thing that my memory remembered a certain thing about this, but I really wanted to know if what I remembered was how it was. And I contacted the Roan. I didn't want my notes just sent to me. And they said that Dr. Buckley would see me. She'd actually remembered me. And Deirdre came with me on my first visit. And Bridget, my therapist, came on my second one. And that was a significant moment for me meeting Dr. Buckley, Olive, she likes to be called, because she believed me. She was the one who'd said that given the extent of your injuries, prosecution was almost a given. But she's commented, and I've checked with her, and she said I can quote her on that. She says, I agree with the comments about mental health. People with mental health are less believed and less likely to progress through the criminal justice system because they're not seen as a credible witness or can't stay engaged with the whole process. The wheels of justice are so slow. And although there's been improvements in recent years, it's still very traumatic, like you were saying with the domestic violence. And she said she can share this, that she's also been through it. And she found it difficult to stick with. She also said that your recovery has given me great encouragement and hope. And do you know what Olive said to me is she said, I remember you. And she said, I remember seeing you underneath all those drugs you were on and thinking there was somebody in there and I hoped that you would recover. And you know, over that period of time, I didn't feel like anybody saw the me underneath. And there's something deeply, deeply healing for me to have known that she thought that at that time. And I think we underestimate sometimes even conversations that I've had with staff when I was an inpatient, you know, just things we've talked about can be so, so helpful. And I want to tell you what happened after this. And even going via taxi alone, I didn't feel I could call any of my friends or ask anybody to take me in. That was my level of not being an anybody. So this goes on to the ECT, because that year after that rape was the 4th time I got ECT. Has had 2 ECT, mood brighter, fleeting thoughts of setting herself on fire, no subjective anterograde or retrograde amnesia. Then we go on ECT number 9, 195.8, whatever those things are, John. Situational stresses are perhaps clouding the effect of ECT. That year I was going through a divorce. The divorce never came through because I was too unwell. Thankfully, because we're back together. Here we sit, the two pie-eyed, I don't know what we are, my darling, but yeah, I was going through a divorce. I'd been raped after a significant history of other traumas. I had no work. I'd moved out of the family home. I don't think I've got a history of poor coping skills, as I keep saying in my notes. I just developed coping skills that I could at the time, which was very creative. Anyway, I can't go through all of this because I've talked far too long, and I need to finish with the little bit of hopeful bit. But basically, it's going through and it's noting that I'm saying it's not really helping. Still going to go and do lithium. And just near the end of the course, an episode of deliberate self-harm yesterday after seeing the children, completed ECT. So at the end of the ECT course, it helped that much that I was still self-harming. CGI score, much improved. But you see in my notes with the other psychiatrist that that's a little bit debatable. And then in terms of progress, in my follow-up 8 weeks later, it says, she states that currently she is in a very dark place. She reports no improvement with her recent hospitalization or ECT treatment. So I still had 2 more courses after that. So just in terms of monitoring and regulation and audit and all of these things, why are we doing the same thing over and over and expecting different results? It's not all about the money either. So I've just got some facts up there about that 1 year, that 2014, without medications, the emergency department 27 times in 1 year I visited, ED visits, ICU, any of that, that would have cost, just for a bed, £72,450 for 1 year, and I spent 8 years doing this. So when we say there's not enough money for specialist trauma therapy, for creative solutions, for art space, for community building, it's where we're putting the resources. We're just doing more of the same and just like recalibrating or reordering it, rather than saying we need to really think about what's working or not. I do believe that shocking my brain because of deep distress caused by things that have happened to me is a violence I should not have had to endure. I do believe that because it has robbed me of this year. This year, I spent a year, I took out of work childminding my son, my precious 2.5-year-old son, with my friend's baby. And I don't remember that year. I don't remember him at that. I don't remember making him his bishy cake. That's his little thing that he loved. I don't remember it. I don't remember my wedding, and I don't remember my graduation. And year on year, my little external memory drive there, I'm remembering more of what I don't remember, significant things in my life. So even though nothing was forced on me, it is a violence I shouldn't have had to endure after what I've been through. Holding hope lightly. I talk about that, holding hope lightly, because sometimes I lose hope still. It's a long journey out of this, and you're just living in the world today. I think we all can, and I know how precious services are and how little time people have. And my uncle and I talked about this web, and at one point, that web was actually a cage where those diagnoses and drugs and labels, because we treat a symptom, because the cultures in so many of the services will blame staff. I recognize that they'll be blamed if they allow, so they don't have options and choice. They're spending keep hearing so much time on paperwork. We can't be with people. So these are structural issues that impact everybody, not just those of us needing services. We're clipping the wings of people who are wanting to do things differently. The web that weaves now, I see that web as a very fluid web. I need these structures and things in place, this community, this connection. My people here, so many of you here today. Gary, Deirdre, Anne, Sarah, all of you. Gavin, you've been so good to me. It's amazing the power differentials that you think you're so less than when you're in services. I can still feel that. And you've got people here who just take me as me. My dog Dexter. My daughter turned 21 and I was there for that. I turned 50, and all those photographs that we've got, Christmas Day, just the four of us, and the kids are so good. Peer trainer role at the Recovery College with you, and that opened a door for me to be able to start to work again. Nobody else would have employed me. Allowed to go and do the things and learn about the system that I had been in on the other side of the door, and I'm so grateful for that. Such an important part of my journey. 5 months in the 12-step rehab with Don, detox of all medications, 2 years of withdrawals, brain zaps, sweats. Oh my goodness, coming off all those meds after being on 30 years. It wasn't really the right way to withdraw, Mr. Reed, but at least they knew that I needed to clear my brain. I did choose a few years ago to go back on low dose of some, but I went on that knowing that what I was taking and what it was doing for me, and it dampens down things because sometimes it can all be a bit overwhelming. So it's about informed choice. People have rights. We're not stupid just because we're distressed. I'm not just suddenly smart because I'm dressed well and I've got my makeup on. That's all me there. People have rights, and there are serious human rights violations currently going on in our mental health services around the detention process. People saying people are being illegally detained, being used to exclude people, people being silenced. And then we talk about social issues. People with social issues need to go to community and voluntary sector who are on their knees. And people with mental illness can use the mental health services. But we know that social issues, poverty, inequality, violence against women and girls, etc., so often cause mental illness. So how are we even separating that out again? EMDR therapy. She's a psychiatrist as well, can I just say? Okay, I've had some lovely psychiatrists these last few years. This isn't about that, but it's just about a way of thinking about things. Reconnecting with nature, strengths, yoga, activism, new script has been so much part of this, and I'm finishing with this here. It is time for a new script for mental health. We need to start destigmatizing and having a different conversation about this stuff. Because whilst we keep locating blame within individuals, we need diagnoses to access things. I'm not saying new script is about choice. It's about come together and have the conversation. Let's talk about this stuff. It's about choices and options, the basics of trauma-informed care. But there aren't alternatives. You have no other way to make meaning of your experiences other than an illness. So that's what Sarah's told you, so I'm not going to say any more about that, but I'm going to finish just with a poem. And this poem, the woman from PILS, the Public Interest Litigation Service, asked me to read this at the end of one of their 3-day thing. And they printed my poem on in this beautiful way. You have no idea how much these things mean, because this isn't just a poem, this is me. And people taking care with those small things is so, so important. And I'm reading this poem for all those parts of me that were judged and labeled and seen as difficult and held down and silenced, and that I abandoned. And it's called Then She Came. This is for Eve. Trauma visited in different dress. I had no choice, no voice, no redress. You don't know if you don't know. Body battered, bruised, betrayed. Head fucked up, confused. Trapped and tried, whilst all around closed their eyes. I'll never be untouched again. And then again, and then again, and then again. Shame too big to have a name, an all-consuming flame, piercing, slicing, penetrating, persistent pain. And then she came. Thank God she came. Soft and sure a choice. Quiet, soothing, consuming, subtly cruel voice. Like head in water, body held, rocked in rhythm with the swell. Pain and shame she would dispel. It felt like freedom, freedom from hell. You just didn't understand and labeled, packaged, risk assessed. Locked up, locked in, just a thing. Pills poured, brain zapped, shut up, shut down, shut out. You don't belong. Don't talk, it'll make you ill. Raped, consumed, discarded in the garbage bin. And then she came, again and again and again. I know her well, her name. So many tears fell unseen, not heard. No hands to hold or arms enfold or shh. I'm here. 1 minute all can be okay, and then we fall, regress, and it overwhelms, fills my chest, no breath escape, no place. The world feels far away, me misplaced. All the theories, brains, and clout, better than, exclusive clang. She promised peace, release. I know now why she came. So I just finished with this. Why does this matter so much? That's why it matters so much. I don't think I need to say anything about that. That was Hannah and I in the Drakensberg Mountains in South Africa in April last year. And I'm so, so grateful for all the people who've walked alongside and continue to walk alongside on this long journey, for this community of the new script that I feel so part of and belonging to for the first time in my life. For people who love me with for Bridget. This should be possible for everybody. Should be possible for everybody. So thank you for listening.